First and foremost, in terms of dementia specific, African Americans are less likely to get a diagnosis early of Alzheimer's and dementia simply because of access to care. That's huge. Looking at multiple morbidities is significant as well. African Americans aren't just, predisposed to Alzheimer's disease, but they're predisposed to diseases that impact Alzheimer's disease, such as cardiovascular disease, heart disease, high blood pressure, diabetes. All of those are relative to getting Alzheimer's or a form of dementia.
In our people, we have a high rate of diabetes, a high rate of blood pressure, and heart diseases. That all affects in the circulation in the blood system, right? And which means you're not getting enough healthy blood flow to the brain. And if you're getting healthy blood flow to the brain, you're putting yourself at risk to develop some kind of a cognitive disorder. So yes, if we have factors of those kind of high risk factors, it puts you at a higher risk of Alzheimer's disease. It's very hard for many Latinos to accept help or admit that I can't do it for myself or feel guilty about it because God knows that my mother raised me, so the expectation now I'm going to take care of her. The other pattern I see also is the word dementia doesn't resonate well in Spanish. It's demencia, which tends to mean you're crazy, there's something wrong with you mentally. So it's almost like a stigma when people start showing signs like that, somebody had dementia, it's like try to avoid them type of thing. So just trying to get that conversation going has been a challenge for us in this community.
Mental health is significantly high in our community, but it's still highly stigmatized as well, right? And so if we're not going to talk about that, then how do we get to the nitty-gritty of all of this? And so what we've done as specialists is to begin to develop programs. So our office began to have a dialogue and a conversation with our community about, hey, Alzheimer's here, dementia's here, frontal temporal, whatever we want to call it. Let's begin to have this discussion so that we can start addressing it. And what we found is that the community initially was hesitant to discuss it because, again, they tied it directly into the mental illness component. Poverty is huge because, again, when we look at the dementia as a whole, right? It's not just one small siloed disease, it's relative to all those other chronic illnesses, correct? And because that's the case, again, access to appropriate care. I can have hypertension and it's uncontrolled, right? Mm-hmm. But let's say I can't afford to take my medication. Food deserts. If I don't have a place to buy healthy food in my community, then I'm going to eat unhealthy. Mm-hmm. If I have to make a decision between paying for a prescription and eating, what's going to be my decision? Poverty is huge across the continuum.
Many individuals, they may take on the role immediately, and sometimes, and I want to say across the board, sometimes they don't always identify themselves as being a caregiver. Mm-hmm. They see themselves as being a dutiful daughter. This is their responsibility. And so sometimes they take on a lot of the care role, and sometimes they don't know about other supports that actually also can help undergird them, that can help assist them as well. And then you have situations where, and I think this sometimes goes across the board, whether black or white, where you may have a family that is quite large and there may be only one person that's doing all of the caregiving.
We developed our own caregiver program. We call them Los Cuidadores Latinos Unidos, which means the United Latino Family Caregivers. So what we do is, if you're the caregiver that I'm working with, we'll offer to come to your house. Going to the house, we're talking to the son or daughter about the stress that they're going through and the behavior they're dealing with at home, and we're teaching them how to respond, how to recognize those symptoms of stress and how they can problem solve differently, and they actually practice different things. And then they practice a wellness plan to give themselves permission to just take a nap. Go have coffee next door. You don't have to clean house while mom's at the day center. Take a break for yourself too. The Latino Geriatric Center, being part of the United Community Center, is here to serve the Latino community. It is designed as a dementia care facility, but it's a day program. We're not a nursing home. So these individuals live here in Milwaukee County. Most are Latinos, and the majority have some form of dementia. I'd say about 90% have some form of dementia. and they're here just for the daytime. So the model that we have here is we provide a place for adult children like us that might have somebody with dementia in our family, a safe place to bring their parents, but also a place that resonates with their culture, their language, their food, their music, their celebrations that we do. That's very important that we know with just any older adult, but specifically we find with older Latino adults because they're far from their home country.
The other thing we did as an organization is that we actually crossed diseases. We realized that, listen, connecting the dots, it doesn't take a rocket science to know that healthy heart is a healthy brain. Why aren't we talking to the Heart Association? Why aren't we talking to cardiovascular folks?
Right.
We need to connect those dots if we're all going to stay in this together. We're working with Well Woman, Wise Woman, Wisconsin to help African American women do a TOPS program, taking off pounds sensibly through our African American churches. We're going upstream. We know it's behavior. We know it's weight. We know that all of that is essential to helping stave off Alzheimer's. Why aren't we doing this in larger facets? And that's what we're going to do from now on.
We've learned a lot that I think we could share with others who would like to try something like this or learn from us, and to be that place where people come to us and say, how did you guys do it? We're thinking of doing this. What would you advise us to do? Because for me, it's personal, by the way. For me, it's a personal mission.
When that caregiver calls and lets me know that they were able to connect with a resource that is supporting them, that's a great day. That's the message that we always want to definitely speak to our families, is that making sure that they are healthy and that they are well, that they can stay in the community. That is a great way to honor your loved one.